In today's world, conversations about the human body are often filled with myths, insecurities, and half-truths. Few topics attract as much quiet anxiety as the question of penile length. For centuries, size has been entangled with ideas of masculinity, performance, and desirability. Yet behind the whispers lies a medical and psychological story that is both fascinating and essential to understand. Every man at some point has wondered, is it normal? Research provides a clear answer. Numerous studies show that the average erect penis measures about 5.16 inches, while the average flaccid length is around 3.6 inches. Despite these facts, men across the globe remain preoccupied, often convinced they fall short of some invisible standard. But why does this matter so much? Why does size, a physical trait with limited bearing on function, become so deeply tied to identity? Psychologists describe this phenomenon as small penis anxiety, a pervasive fear that one is inadequate compared to peers or to unrealistic standards set by pornography. This anxiety does not merely live in the mind, it affects relationships, self-esteem, and even decisions about undergoing drastic medical interventions. Modern medicine has long sought to answer these insecurities with treatments ranging from gentle and non-invasive methods to surgical extremes. But before exploring them, it is worth remembering a crucial fact. Studies consistently show that partners, especially women, rarely prioritize length. In survey after survey, factors such as communication, affection, and confidence rank far above physical dimensions when it comes to satisfaction. And yet, the industry of enlargement continues to thrive. The most accessible interventions are home methods. These include stretching exercises and devices designed to create traction over time. The theory is straightforward. Applying steady, controlled tension to the penile tissue stimulates microtears that heal with new growth, slowly increasing length. One of the most studied devices is the traction extender. Clinical trials have demonstrated modest but measurable gains after months of consistent use, typically 0.5 to 2 centimeters. These devices require discipline and patience, often demanding hours of daily wear. The question becomes, how many men possess the perseverance to sustain such a regimen? Then there are pumps, often marketed as quick fixes. These devices create a vacuum that draws blood into the penis, producing temporary engorgement. While useful in treating erectile dysfunction, pumps are not a reliable solution for permanent enlargement. At best, they provide short-term gains, often exaggerated in advertisements. At worst, misuse can cause bruising or tissue damage. Here, the line between medical use and commercial exploitation becomes clear. A more recent development in the field is the use of injectable fillers. Borrowed from cosmetic dermatology, these procedures involve injecting substances such as hyaluronic acid into the penile shaft. The result is an increase in girth rather than length, creating the visual impression of enhancement. Initial results can appear dramatic, but the effect is temporary, lasting from 12 to 18 months before reabsorption occurs. More concerning are the risks: uneven results, nodules, or complications if the filler migrates. And yet, demand continues to grow, fueled by social media and the rising normalization of cosmetic procedures. At the far end of the spectrum lies surgery. Penile lengthening surgery often involves cutting the suspensory ligament that anchors the penis to the pubic bone. This can allow more of the shaft to protrude externally, creating the impression of added length. Yet the gains are usually modest and the risks substantial. Without the ligament, stability is reduced and erections may angle downward. Scarring, infection, and dissatisfaction are common. For some, the price, both financial and physical, is devastating. It is important to note that surgery is not universally condemned. In rare cases of true micropenis or congenital abnormalities, surgical intervention may provide real benefit. But for the vast majority, experts caution that the risks outweigh the rewards. What men often fail to realize is that dissatisfaction lies less in centimeters and more in perception. Beyond medicine, cultural expectations play a decisive role. In many societies, myths about virility and dominance still persist, amplified by media and pornography. These ideals rarely reflect reality, but they shape desires and insecurities nonetheless. The irony is striking. While millions worrying about inadequacy, most fall well within the range of average. Studies reveal that the gap between perception and reality is far wider than the gap between one man's measurements and another's. Consider this example. In one survey, men consistently underestimated their own size compared to what women reported finding acceptable. This disconnect highlights the role of distorted perception. If the mind is convinced of inadequacy, no ruler will provide reassurance. So, what is the future of penile enhancement? Research continues into safer, more effective methods, from tissue engineering to regenerative medicine. Scientists are exploring stem cells, platelet-rich plasma injections, and bioengineered scaffolds that might one day offer real, lasting improvements. But these remain experimental, far from mainstream use. For now, the options remain limited, imperfect, and often risky. Where does this leave the anxious individual? Experts emphasize the importance of psychological support. Therapy can be as powerful as any device or procedure, reframing expectations and addressing underlying insecurities. Education, too, plays a role, understanding averages, knowing what is realistic, and learning that sexual satisfaction is multidimensional. A healthy relationship built on trust and intimacy consistently outweighs numerical concerns. Ultimately, the pursuit of enlargement reveals more about culture and psychology than it does about biology. It exposes how identity and worth become tied to physical markers, and how industries profit from insecurities. The question is not whether enlargement is possible, but whether it is truly necessary. In the end, the message is clear. Average is enough. Confidence, connection, and communication hold far more power than inches ever could. For those caught in the grip of anxiety, the greatest growth may not be physical at all, but emotional recognition that worth cannot be measured with a ruler. This perspective may be the most profound enlargement of all.